Month's topic, the controversy over the new drug marketed specifically to African Americans. Joining me now to shed some light on the subject is cardiologist Dr. David Kraus. Dr. Kraus, thanks so much for joining us.
Well, thank you for having us come down and do this interview.
The drug we're talking about is Vidal. Tell me what it is and how it's used.
Vidal is a combination of two agents. One is a drug that's called Isordil. The other is Hydralazine. Both of these agents have been around for at least 40 years. And it's used in African Americans that have class 2, 3, and 4 congestive heart failure to improve their mortality from all causes of death, as well as a repeated hospitalization rate, and to improve their quality of life.
Tell me why it works better in African Americans.
The theory behind it is that nitric oxide, which is the benefit-producing agent, so to speak, at the tissue level and vascular level, is deficient in many African Americans. The Isordil molecule donates or helps form a second nitrate molecule at the tissue level, and in doing so helps improve vascular function and heart muscle function.
This is very controversial. Tell me why it's so controversial.
Well, it's hard to pick and choose drugs based, at least in the practice of medicine, based on race alone. I don't think that we're used to doing that. I think it also sets some precedents as far as maybe looking at certain patient populations in a different manner, and I don't think that's the way we should practice medicine. Clearly, these drugs do benefit patients that are not of African American descent, and this combination therapy will do so in certain subsets, but it's apparently, not going to be to the same degree.
Have you seen a certain resistance among African Americans from wanting to use this type of a drug?
Not at all. I haven't had anybody come and ask me for it. I think you should, if you have a history of heart failure, consider doing so. You should go and ask your doctor, should I be on this medication, particularly if you're not stable on your present medical therapy. This is an add-on to the standards of care that are already provided for heart failure management, which includes a series of 4 or 5 drugs in most patients, and certainly is not a substitute for any or all of those treatments.
Dr. Kraus, thank you. Thank you so much for joining us.
You're welcome.